I'm Dr. Manoj. I'm the surgeon here in Atrium Hospitals. So we will start with our today's program, our today's scientific session, our today's educational program from Atreum Speciality Hospitals. Now, I think last week or the last time we had a chat, it was regarding sugars, diabetics. Today we will talk about one more issue that is extremely common, especially in women, and especially in women of reproductive age group, the productive age group, which is roughly between 18 and somewhere between 55-60. Right? The issue that we are going to talk today is regarding the glands, thyroid glands. Right. Thyroid gland is one gland which secretes thyroxine, which is required for functioning of all the organs in the body. So, if there is something wrong with the thyroid gland, then the entire body goes into disarray, right from the brain to the heart, to ensure that the thyroid gland is correct in every individual, in you, in me, and our friends and families. Roughly in the lower neck, not so high up in the neck, but in the lower neck. Now, if this gland enlarges, if it's a butterfly-shaped gland, that side, two wings, and then in the stem in the middle. So, if this gland enlarges in size, then that is what is technically called goiter, right? So, how does one know whether the individual has got goiter or not? It's simple. All we need is a glass of water. What we need to do is we need to drink a sip of water, have it in the mouth, look up, and then drink the water as and when we are looking at ourselves in the mirror. So, we look at the mirror for the neck when we are drinking the water. What we are looking for is movement of swelling or a lump in this region, right? So I just demonstrated. This is what we need to do. Right. So normally when we swallow, we shouldn't see anything here. But in case we see a lump which is apparent, which is easily made out when one is swallowing, then we say that that particular individual has got goiter. Now, this particular goiter can affect the left side, can affect the right side, or it can affect both the sides together at the same time. What are the reasons for an individual to get goiter? When she has attained her age, or when a girl is becoming mother, when the lady is pregnant, or when the lady is feeding the baby, if she's a nursing mother, then some amount of enlargement of the thyroid gland is considered normal, right? So some amount of enlargement of the thyroid gland is considered normal, and that is nothing to be done for that except for some reassurance for the girl or for the lady or whoever it is. Now, some other thyroid glands, it's common in certain areas. That's called endemic goiter, especially in people who are living in the banks of a river, because this river water washes away all the iodine in the land, in the sand, and therefore that particular area, the vegetables or the food that we eat, is deficient in iodine. Therefore, a large community and everybody will have goiter if they are endemic to that area. Now, that problem has been nullified because we use iodized salt of late. Almost all the salt making companies, the corporates, fortify salt with iodine, and therefore the endemic goiter to a large extent is taken care of. Now, the other reason as to why an individual can get goiter is autoimmune, which means to say that your body is destroying your own thyroid gland. Right. Why it happens? Why does one become autoimmune? Nobody knows. But some individuals produce antibodies. Now, antibodies are immunological substances which give immunity to our body. So that is what will prevent the bacteria or the virus from infecting us. That is what will fight against the invading organism or the invading pathogen. Now, sometimes what the body does, it thinks that thyroid is not self. It thinks that thyroid is a foreign material, is like a bacteria or a virus, and our body, the immune system of our body, produces antigens which destroy our thyroid gland. It can be Graves' disease or it can be Hashimoto's thyroiditis. Now, these are the two commonest forms of autoimmune thyroiditis. One is Graves' disease and one is Hashimoto's. Now, we need to identify the difference between the two, because to a large extent Hashimoto's thyroiditis is self-limiting. All we need to do is we need to take care with medicines for a certain amount of time, and Hashimoto's thyroiditis will limit itself on its own given time, maybe 6 months, maybe 1 year. That will depend on the individual. On the contrary, Graves' disease is a much more aggressive disease. We need to be a little more diligent in identifying Graves' disease and in managing the individual. With what we'll talk about the modalities of treatment a little later. Now, the other reason which is of importance or significance as to why an individual can get goiter is cancer. There are different types of cancers that can originate from the thyroid gland. Papillary carcinoma, anaplastic carcinoma, follicular carcinoma, so many types of cancers, and that also can manifest as a nodule or as a goiter in the thyroid gland. The other thing is called as a nodular goiter, which can be on one side or which can be off. Now, the importance of finding out whether it's a nodular goiter or cancer is, if it is a nodular goiter or if it's a cancer causing goiter, then medicines are not the right choice because they don't work in those individuals. So medicines don't work in people who have nodular goiter, and medicines don't work in people who have cancer of the thyroid gland. So in these two scenarios, surgery is the primary treatment and it's mandated. The disease process is like that. And thyroid is one area where surgery gives 100% cure. The thyroid cancer is one type of cancer which is completely curable. That's one of the few curable cancers in humankind. Now, what are the symptoms that a patient can have? By and large, it is goiter, which means to say that there can be a swelling here. That swelling is either noticed by the patient herself or himself, or it is noticed by somebody else in the family, in the friend circle, as a nodule or a lump. So, apart from that, apart from the fact that an individual can present with a nodule here, there are, we said that the thyroid gland or the secretions of the thyroid, or the hormone that is secreted by the thyroid gland, that's the thyroxine, has actions throughout the body. So, depending on whether the thyroid produces more thyroxine or depending on whether the thyroid produces less thyroxine, the body produces different kinds of symptoms. Let's talk about heart. An individual can have palpitations. A palpitation means awareness of one's own heartbeat. Suppose we get scared suddenly. You get that feeling. That can happen in hyperthyroidism or when the thyroid gland is secreting more thyroid. Right? If we talk about the brain, there can be anxiety. There can be disturbance of sleep. The patient is always worried. There can be excessive sweating. Patient is very active but only for a short period of time. Patient climbs a floor of steps, one floor. Patient becomes extremely tired. Easy fatigability. All that, and in women especially, there can be alteration in the menstrual cycle. The cycles can become more frequent, right, or less frequent. Both can happen. Irregularities of the menstrual cycle. The first thing that we need to do is we need to check the thyroid profile. We need to check whether the hormones are in control, T3, T4, TSH, all three, whether all three are normal or whether they are abnormal. So the functional disorders of the thyroid gland can have symptoms across the body. It's not one particular organ that's affected. The entire body can get affected by the thyroid gland. Apart from the swelling per se, and apart from the symptoms of function, patient can also have a sense of discomfort in the neck. Now there's a swelling here, and that can produce some kind of discomfort, or patient may feel that something is pressing on the neck. Our food pipe is here, so whenever the patient swallows, patient may feel that he or she is having difficulty in swallowing. The air that we breathe goes to the lungs in the chest through the pipe here. So an enlarging thyroid can block this pipe, whereby the patient may feel That patient has got difficulty in breathing. Every breath is laborsome. Every food that the patient takes can become laborsome. One significant thing is the voice that we produce is controlled by a few nerves here. So an enlarging thyroid gland, if it is cancer, can invade these nerves, can infiltrate the laryngeal nerves, which are responsible for production of sound. And therefore, our quality of voice can change. There can be hoarseness of voice, or there can be loss of pitch, both. So if an individual has got a swelling here, or if an individual has got sudden change in voice, 20 years, 30 years, you have got some voice, and suddenly, if your voice has changed in 2 weeks time, in a week's time, in a month's time, then I think you should meet us in Atrium Hospital. That's one reason for change in voice is infiltration or involvement of the laryngeal nerves by cancer of the thyroid gland. Right? So apart from this, there are so many other symptoms which are non-specific, which may be loss of weight, loss of appetite. Yeah. So other common symptom is inability to use proximal muscles. Climbing up the stairs, walking down the stairs, combing hair. If you find buttoning shirt, threading a needle, all that is fine work. That is usually unaffected. But using bulky muscles, shoulder muscles, using bulky muscles, hip muscles, those muscles may get fatigued easily. So if a patient wants to go for a swim, good swimmer, even within the first lap, patient can become tired. That again is a symptom of thyroid disease. So how do we identify? What tests? So once you come to the hospital, your clinical examination is by and far the first thing that is done. You would have done it at your house or at your residence itself in front of a mirror standing, or you would have asked somebody to look at what is happening in your neck. But when you come to the hospital, what we do, the first thing we do is we talk to you. When we are talking to you, we try to find out is it a functional disease, or is it a structural disease, or is it a cancer, is it nodular goiter, what kind of goiter you've got. And we also try to find out whether it is cancer. That happens within the first 5 to 10 minutes, interaction within the 5 to 10 minutes. So once our clinical suspicion is there that it may be a goiter, then we need to do some blood tests. The first and foremost is thyroid function test, which includes a panel of 3 hormones, which is T3, T4 and TSH, which is triiodothyronine, quadriiodothyronine and thyroid stimulating hormone. Once we do this, we will know whether your thyroid is normal functioning normally, or is it hyperfunctioning, or is it hypofunctioning. Right? So based on that, if your thyroid is normal and if you've got swelling, then the next thing, if your thyroid is alternating in function, we will talk about the medical management a little later, which is the first thing to do. If your thyroid is functioning either high or low, we have medicines to control it. But if your thyroid is normal and if you've got a swelling here, then the next thing that we do is what is called as a scan. The next scan, a regular ultrasound, the ordinary ultrasound or scan that is commonly available. That's what we do. We use a high frequency probe, we keep it on the neck, and then we check whether it is only the thyroid that is enlarged. Is there fluid in the thyroid gland, or is it a solid swelling in the thyroid gland? Are there any other swellings around the thyroid gland, which is lymph nodes? What is the relation between this thyroid gland and the foot pipe? What is the relation between the thyroid gland and the trachea? Trachea is the jugular veins, which carry blood to the brain and which brings back blood from the brain. These blood vessels again can be engulfed, can be compressed by an enlarging thyroid gland. So what is the relation between the thyroid gland and these blood vessels? Now, all this information we will get through an ordinary ultrasound scan of the neck. Right. So if you have got goiter, while we are doing ultrasound, if you've got nodules, we can also put a small needle here in your thyroid gland. We will aspirate some blood, we will draw very little blood and then send it for analysis. That is called FNAC, or fine needle aspiration cytology. And so under ultrasound guidance, while doing ultrasound, we put a needle in the neck on the thyroid gland and then we send it for analysis. That to a large extent will tell all of us as to what the problem might be, because goiter is just enlargement of the gland. The treatment will depend upon why your gland is enlarged. What is the reason for goiter? If it's cancer, surgery. If it's nodularity, surgery. So if it is autoimmune, then depends on what type of autoimmune. Graves' disease, management is different. Hashimoto's, only supportive care. If it is endemic goiter, we give iodine, you will be alright. Right? So it is like that. So an FNAC will tell us, is it cancer or not? And if it is cancer, what type of cancer it is. All this information we will come to know through an ordinary, simple FNAC procedure. This FNAC procedure will take roughly about 6 hours. So within your stay in the hospital, by the time we get an FNAC, it's just like a blood test. No? Within 3 to 6 hours, your report will be completely ready. It's a daycare procedure. Alright? Right. If there are no nodules, and if your thyroid hormones T3, T4 are quite high or they are quite low, then we do another blood test called as anti-thyroid antibodies. Now, there are two types of antibodies here. One is called as the antimicrosomal antibody or the TPO, thyroid peroxidase antibody, and the other one is called as antimitochondrial antibody. So these two antibodies, if we do, we will come to know as to whether you are having Graves' disease or you are having Hashimoto's. If both are elevated, it is Graves' disease. If only one is elevated, then it is Hashimoto's. Centers, very few centers do that isotope scan. Suppose the thyroid hormones are high and we find that there are multiple nodules in your gland, then we do this test, this isotope test. That isotope test thyroid gland hormones or whether the internodular tissue is producing the increase in the thyroid gland, because the treatment is different. If the nodule is producing, we can tackle the nodule. If the internodular tissue is producing, then most likely you will need to come back for surgery, because we don't have medicines to take care of the internodular tissue. Right? So we have a large armamentarium of tests that can be done, which will pinpoint as to what is the disease you are having, as to why one developed goiter in the first place. Once we identify, how is it treated? There are three modalities of treatment. One is medicine, one is surgery, and another is isotopes. It's called radio ablation. Right? Medicines will function in hypothyroidism. Right? Suppose the thyroid glands are completely damaged by the antibodies that our body produces. Then we give these medicines, and usually patients, the individuals, need to take these medicines for life. Right? So that is in hypothyroidism. These medicines do not help the thyroid come back to normalcy. They do nothing to the thyroid gland, but they act on all the other organs in the body. So they are just replacements. What the thyroid is supposed to do, it is supposed to produce thyroxine hormone. If it doesn't do, then we give this hormone orally. So that hormone does the action of the thyroid gland. So when you have hypothyroidism, and if we are producing medicine, if you are prescribing medicines, these medicines are normal. We don't have any medicines till now to make your thyroid gland normal. These medicines will take care of the body, will prevent the symptoms of hypothyroidism. They will act on all the end organs, the brain, the heart, the lung, the liver, the kidney, and all the other organs, and make sure that you don't develop symptoms of hypothyroidism. That is what these medicines will do. Now, if your hormones are high, if your T3, T4 levels are high, then medicines are temporary. We have to give you medicines, a different set of medicines, not the same set of medicine, not the thyroxine, not the replacement medicine, but a different set of medicine to stop the thyroid gland from producing excessive thyroxine hormone. And we also will give some other medicines which will stop the organs from using the excessive thyroxine that is present in the body. So we may prescribe one or two different set of medicines depending on how severe your symptoms are. You know, one set is to decrease the production of the thyroid gland, and another set is to prevent the action of this hormone on the end organs, on all the vital organs in the body. Now, once your symptoms are controlled both clinically and biochemically, when you are taking, usually it takes about 6 weeks. By 6 weeks time, after hyperthyroidism, if we give medicines, by 6 weeks time we would have identified the correct dosage, how much you require, because we start with a very minimal dose and we escalated every 3 or 4 days depending on pulse rate and depending on the biochemical changes with T3T4 in the lab. So by 6 weeks time, we would have identified the correct dosage that is required for you in your body, and once we identify that dose, then we need to discuss what next. Because how long? Because this is something that is completely curable with surgery, and something that is completely curable with of the gland that will take care of symptoms as well as the enlargement. If you don't have goiter and still your gland is producing more, then radioablation is the best option, because you can avoid surgery. Because radioablation does nothing to do with the size of the gland. It will just decrease the function of the gland. It does nothing to do. In fact, sometimes initially there can be increase in the gland size, which can be dangerous. Right? So radioablation is used when you don't have enlargement of the gland, but you have symptoms of hyperthyroidism. Right? This is with reference to function. If it is a nodular goiter, if it's not either one side or both sides, or if we diagnose that you have got cancer of the thyroid gland, no questions asked, you come directly to the surgery. We will operate on you, and surgery will depend on the morphology, meaning to say we may remove the entire thyroid gland if it is cancer. If it is nodule and involving both the lobes, then we may remove the entire gland. But if there is a nodule only in one lobe of the thyroid gland, then there is no need to remove the entire gland. We can remove only one half of the thyroid gland, and the advantage of removing only one lobe, whichever is involved with the nodule, is that you don't need to take medicines after surgery. If we remove the entire thyroid gland in cancer or in multinodular goiter, then you need to be on medicines, thyroid suppression of thyroid in cancer and replacement of thyroid in total thyroidectomy. Radioablation surgery is it's not a major surgery, it's not a minor surgery. It's technically challenging, but we have done it, and we have done it with good success in our hospital, in Atreum Hospital. You will be given general anesthesia. It will put you to sleep, and by the time you wake up, surgery would have been done. You will have a scar here in the lower aspect of the neck, which is very inconspicuous. Unless somebody specifically looks for a scar, people may not even notice that you have been operated upon. It's quite cosmetic, and you will have to stay for about a couple of days in the hospital, 2 nights probably hospital. Sometimes after surgery you will have a tube coming out of the neck. It's called a drain, and by 24 hours I'll remove the drain. By the 48th hour I'll send you home. By the second day you go back home. Right? Surgery may take about 1 hour, 1.5 hours, and it's about 2 days stay. That much about surgery. So we will recommend the right center. We will recommend the right person as well. So it's just a drink, either milk or orange juice, which is mixed with the medicine. You will have to drink it, and this medicine which is given in the drink will destroy the thyroid gland that is producing excessive thyroid hormones. Right? So that is the basis of radioablation. Usually 2 to 3 sittings are necessary with radioablation. One sitting of radioablation may not yield complete cure. Second sitting after 4 weeks or after 6 weeks may yield about 90% results, which may be adequate in a large population of individuals, but in a very few individuals, radioablation may be required in the third sitting also. Right? So, but this radioablation cannot be used in children. It cannot be used in people who are pregnant, in women who are pregnant, and it cannot be used in women who want to become pregnant in a short span of time. Right? So those are the shortfalls of radioablation. So if you're filling into any of these things, if you are pregnant, or if you want to become pregnant, or if you are a lactating mother, or if you're a child, then maybe we'll have to think about surgery in you as well. Right, so basically that sums up. So in the last maybe 20-25 minutes, what we have discussed is what is goiter and how to identify whether one has got goiter, what are the reasons as to one develops goiter, and what are the symptoms that one has got, what are the symptoms that one can expect if there is goiter, and how to differentiate nodular goiter from colloid goiter, from endemic goiter, from cancer of the thyroid gland, how to diagnose, what tests are done, what will you experience, those kind of things. And we also spoke in brief about the treatment options. What are the medical options? What is medical therapy? What is isotope, radioablative therapy? And what is surgical options available? Right? So I think that sums up. If you've got any of these issues, you're always open. And with this, I think I'll thank you all for patient listening. I apologize for the delay in the transmission because of technical glitches. I take the blame on behalf of our hospital. And you're always welcome. Atrium Hospital is always open, and we'll take care of what we can. You're in best hands. You don't need to worry with any issues that you've got. Right? Thank you, and hope to see you again. Bye-bye. Best of luck.